talking about being a part of a team. I know your kids, they play sports. So my question I want to ask is, what role do you think sports has in your life?
I think sports teaches you so many things. I think it teaches you teammanship. It teaches you how to deal with adversity, right? How to deal, you get an injury or you lose a game, or how do you fight adversity?
Mm,
It teaches you how to work with people of all different areas from life, walks of life, right? So being part of a team is a great thing for life. It teaches you leadership skills. So I think it's really never ending. And so I'm a big proponent of it. And I love to talk to my patients about it
hmm
also and what a role it plays for them. Because I think it, especially on the football side, I have talked to so many of the players and they say, this is what got me out of where I grew up, right? I grew up in a bad area and my dad was in jail. My mom was not around or whatever. My grandmother raised me and sports were what I knew. Sports were where I made my friends and my relationships. And this is how I got to where I am. So I think it gives people opportunities. So I'm a huge fan, and my daughters play sports, and they're ages 13 and 15. And again, and sports are different. You know, one of them is a horseback rider; she's an equestrian rider, and that's her sport. And the other one plays soccer and lacrosse, and so it's very different. But they still provide you the same thing. I was a swimmer, and everyone says, "Oh, it's an individual sport." It's an individual sport. You definitely have a lot of individual pressure, but you're also part of a team. And so, together you're trying to win the meet or.
So continuing down the sports theme. So I hear apparently you have a crazy morning routine. Tell me about it.
No, I'm just an early riser. My
How early?
I just naturally am up. I mean, I don't really set an alarm. I'll get up. It depends on the time of year. In the summer, I'm up 4:35, but in the winter, I might sleep till 6.
Yes.
Even on the weekend, so makes my husband crazy. But I'm a big believer in that early to bed, early to rise makes a man healthy, wealthy, and wise.
Oh, I like that.
So that was kind of my thing. I'm productive in the morning. I'm certainly a morning person, and that's when I can get most of the work done.
Well, maybe you'll figure out a way to clone a second version of yourself.
Right, exactly.
So you can get everything.
Have the active one and then the work
Exactly. Yeah. Okay, so you might have thought about that once or twice in your life.
Exactly.
You went biking, and then you had a bad accident, and you end up in the hospital. And I think shoulder. You had shoulder surgery. So if you want to elaborate a little bit on what happened and what was it like being on the other side of sports medicine as a patient.
Yeah, that was tough. That was I think 5 years ago now, but it was when I had first left Pittsburgh and I came to DC and I joined the Washington football team, the medical team as their head team physician, and it was my first time to be on the sideline of my former team, right? So I've been in the Pittsburgh Steelers for 11 years. So here I was super excited about it. It was going to be Monday Night Football. Sunday, the Steelers were coming into town. I was going to meet their medical staff for dinner that night. I was super excited. So Sunday morning, early in the morning, again, I get up at like super early. So it's like 6 in the morning. I go out for my ride. The sun's just rising. And I'm in Great Falls, riding kind of through the backcountry roads, coming down a hill at about 30 miles an hour. And a groundhog comes out of the shadow. I don't see him. And I hit him and I flip my bike. And that's all I remember. I remember going over it. And then I was I was unconscious. So
instead of 6 weeks of winter, you had 6 weeks of injury.
Exactly. It was a long road. So I had my GPS watch on. I apparently was unconscious for 5 minutes in the road, laying there. When I got up, I had no idea where I was. I pulled my bike off and so I called my husband and I said, I don't know how I got here. Am I in a dream? And he's like, what are you doing? And I said, I don't know where I am, Mark. And so luckily I drop a pin on my Google Maps and I figure out where I am and I show him. Long and the short of it is he takes me to the trauma center where my friend and colleague Steve Malexada, he treats me, and I had shattered my humerus, my shoulder, and broke a bunch of ribs and had a concussion. So he takes care of me. I wound up having some complications from the surgery and had 2 additional surgeries. So
I didn't know that.
It was a long road and it was hard all around, like you said, being on the other side of the table for the first time in my life, really in that aspect, having to miss an opportunity. I couldn't go to this game, obviously. And here I am just starting this new role with the team. So a lot of things were taken away from me that I never really had taken away from me.
Wow.
All of a sudden my job's taken away. The things I love doing, I love biking, I love doing all this stuff. And here I am laid up for 9 months really with multiple surgeries.
Oh, I did not even know that was all
Yeah,
that
I was
complicated.
able, I mean, I got back in the operating room 6 weeks later, but
Yeah.
I couldn't really use my arm. I had it kind of pinned to my side. And so trying to deal with that as I'm trying to recover from this injury and get back to the things I love doing, working and being active and dealing with the complications also. So it gave me a really different outlook on life all around,
Hmm.
and really realizing how important it is that, sometimes you've got to lean in. People always
Yeah.
say, as a woman, you've got to lean in, right? Lean into your
Yes.
career, but sometimes you have to lean on. Sometimes you
Yeah.
have to get help from people. And so I realized that, you know what, I actually need to take my partner's help and my husband's help and my kids' help, and I have to use them.
And so from that experience, like from high school, you had the mono, and then you were able to do that, go to the field of orthopedic surgery. You had that 9 month period. Like, what were you able to apply to that for the continuation of your medical career? What did you take from that, and like, how did that help you with patients after that injury?
It gave me a perspective on the psychological aspect, I think.
Hmm.
I'm always like, yeah, I'm tough. I don't really need any help.
Yeah.
And, then all of a sudden this happened, and you're like, God, like it's a huge mental hit. And so I think that I'm really fascinated by that when I see anyone in my office who has an injury. Yesterday, unfortunately, saw 6 girls with ACL tears who are playing
Mm.
sports, and they come into the office and their parents are asking me, hey, what's your one piece of advice to my daughter as we're going through this process? And I said, it's psychological. You've got to, right now, you have this injury. So many things are going to be hurt by this, right? Not just your knee, but now your teammates and your all your social aspects, your parents' social aspect. So we've got to start to focus on the next step.
Mm.
And the next step from here is we're going to fix your knee. And the next step after that is you're going to then go to physical therapy. You're going to get on a bike.
Yeah.
And you've got to look at this stepwise approach, because the psychology of an injury is huge, and we have to help you recover from that side.
So you talked about earlier, you do like the ultra races, Ironman and all that. So tell us, what's that like?
Yeah, so I like to compete in these triathlons. They're multi-sport events, right? So I haven't done a full Ironman. A full Ironman is a lot of time, and I don't have time to train for it. But I did an Ironman 70.3, which is half an Ironman. So I did that before my injury, like the year before my injury. But it's great. It's a lot of training, and it's really mental fortitude, because it's a long race and trying to get through it. And I did the Eagle Man, which is out in Cambridge, Maryland. And that day, the temperature spiked to 93 degrees.
Oh.
So it's hot, it's black asphalt. And so getting through that, you're conditioned, you've trained for it, but then it's the mental component. So I like challenging myself on both those sides with the race. It's not sort of the fastest and most furious, but it's really sort of that long process as far as physical and mental capacity.
Honestly, that even sounds like medical career also.
That's right, exactly.
One of the things you mentioned about your interview, you have you have your lovely family, husband, and your daughter. So tell us a little bit about them, and what role do they play in your life?
Yeah, they play a huge role in my life. Obviously,
Hopefully.
they're my home base, right? So
Yes.
things have changed, obviously, as the girls get older and understand more. It was hard early on. Peyton, my littlest one, was very attached to me, and early on she'd say, "Why do you have to work? Why do you have to do this and this?" And she'd always want me to stay home with her. And unfortunately, especially when they were young, I was traveling a ton because I was taking care of all the teams and being busy at work, and I do a lot of stuff on the national level as far as academics and
Yes,
teaching.
of course.
But then I remember when we first moved here, and so she was like 8 or 9, and we were talking, and I said, Peyton, do you really want me to give up something? Because I will give up something for you, and I to be home more and to do something else. So just let me know. And she said, well, Mom, but you really love what you do. And I said, I do. And she's like, well, what do you love the most? And so we went through it. She's like, you love this and you love that. She said, so why would you ever stop doing it? She said, if it makes you happy, it makes me happy.
Oh, that one, actually, that one would even scare me as a question. It's like, do you love me the most?
And all of a sudden she's like, no, you can't. And it's funny because now when I make changes to my career, I do something different or add something on, she's like, don't give that up, Mom. You like that. Why are you doing this more? She definitely is very opinionated on what I'm doing. And, they're incredible. My husband, obviously, he's been there through everything, really, through all my training. And when I was in residency and, working 120 hours a week and not around at all.
Yeah.
They're the heart and soul.
So we could see throughout the interview, I think apparently you have a lot of different roles. I can pick up on that. So, and then how do you balance all those things and even making it to your kid's soccer game? How do you balance everything? I feel like all the juggling. How do you do it?
Yeah, it is. It's hard, and people always ask me that. And there are times where things are going to be out of balance, right? And you have
Yeah.
to try and figure out what's your number one priority. My number one priority is going to be always my family. But again, when do they really need me, right? If they're sick, they need me. Then I'm going to change everything. Things are going to go out of balance, and I'll be there for them. But again, being part of their lives and going to their events and their sporting events, that's what I love doing. And so maybe I wanted to go for that bike ride, but instead I'm going to not do that, and I'm going to go be with my kids. Or again, I have great partners at work, so when I'm covering the Washington Nationals, I don't have to be at every game. I have to be at a lot of the games. And we have 81 home games, but I have partners who help me cover, and so I don't have to be at every single game. And I'll adjust my schedule accordingly. I'll look at I take their sports schedule, I take my schedule, and then we try and mish and mash and make it work.
So if it sounds like to me, I guess in my doctor notes, it sounds like I guess the two key things is priorities and having a great team. Sounds like in your life.
That's exactly it. You got it. Good takeaway points.
A lot of medical students, even me myself, they suffer imposter syndrome. You feel like with imposter syndrome, you feel like, oh, what am I doing here? I'm a fraud. I don't know if I can do this, if I can even do all these things. So one thing I want to ask you with that is, what can you say to people when they have any challenges, obstacles? What drives you? What pushes you in your life and career?
Yeah, that's interesting, that imposter syndrome.
Yes.
I mean, I think that we all feel that, right? And so we're all going to have some sort of anxiety or doubt. But I think that my mom always told me, again, get out of your comfort zone. Get out of that. That's where the things happen. And if you fail at it, you fail at something. It's not a big deal. You can go on, and you're going to learn from that experience. So, as Wayne Gretzky always said, Wayne Gretzky's a famous hockey player.
Yes.
But as Wayne Gretzky always said, he said, you're going to miss 100% of the shots you don't take. And so that's what I'd say. I'd say to people, give it a try. Put yourself out there. It may be hard. You may feel like an imposter trying to do it, but if you go forward with that fortitude and high integrity is key, and work ethic. So just put yourself out there and try the things. Otherwise, you're going to miss an opportunity.
And that's our show today. So my name is Peter, and thank you, Dr. West, for everything today.
Thank you, Peter, for having me. I really appreciate it. It was great.
Thank you. So if you like more of the episodes, please make sure to like, comment, and subscribe to the series. So thank you guys very much.
Thank you.
And you guys take care.